Hi, I'm Jake Morris. I'm an emergency room physician serving with Samaritan's Purse here in the mountains of Papua New Guinea. And you can follow me along today as I go throughout my day. On Mondays, we start our morning with worship over in the chapel, and then we'll head over to doing rounds into the emergency department. We're just gonna go grab an ultrasound. So we start each day by rounding through a ward. This is our medical ward, and we usually have about 2 doctors on each ward, and we'll take turns rounding through our pediatric ward, our medical ward, surgical ward, or our obstetric and nursery. And today we're on the medical ward. And we've got 3 doctors rounding. The little kiddo had a big abscess on the leg and up here that So, M-born, one time M-born, M-born now morning, M-born, okay. This is my office, and we're just gonna grab a handheld butterfly ultrasound so we can go take a look at that gentleman's heart. I usually have it in my backpack with me, but forgot to bring it today. So you see how that right side of the heart up here, right ventricle, is a lot bigger than the left ventricle, and that should be the opposite. So the left ventricle should be quite a bit larger than the right ventricle. What he has is HIV, which he has been off of treatment for a while, and then has an infection. It has tuberculosis in the back that's leading to all of the kind of pus from tuberculosis coming out of the back. Behind 10 mL tassel. In the United States, all of the charts are on the electronic medical record on computer. Here, this is our chart. So we've got a paper record, paper chart. And then this is the scale book. So this is what patients carry around with them to record all of their medical information on. And sometimes you'll see they'll have a couple scale books stapled together. And sometimes scale books will get lost. Sometimes they'll have scale books from other family members that they bring in for them for the hospital. So interesting system. It overall does work, but leaves some things to be desired. So now we're over in the ER. I'm just taking a look. When there are charts for the doctors to see, they sit over on this side of the box. So it looks like 1, 2, 3, 4, 5 to see right now, which is not very bad for a Monday morning. Right now the ER is pretty good. I'm sure by this afternoon it will be filled up with people. So I actually know him. I've admitted him before for his blood cancer, and we just kind of talked about how his life is close to finished, and there's nothing else medically really that we can offer him. So we prayed, and he understands that, and say goodbye to his family and prepared for what's next. So if he moves a lot and fights, we may end up having to try this again. We can get it done sometimes. Yeah, me think I'm close to finishing suit ploem. Okay. This is my friend Daniel. He got hit by a dump truck 2 weeks ago here. One car bumping you. Okay. So 2 plaboon here in Brook. So he shattered his tibia and fibula. So we haven't put him in a cast yet because he had so much swelling. We needed to wait for the swelling to go down before we put the cast on. But I think we're ready to straighten out the bone and put a cast on today. So today, me I put him cement. So his didn't need a lot of straightening. We just held it to length and got that cast around it. There are lots of bush knife injuries here in Papua New Guinea and lots of domestic abuse here in Papua New Guinea. So probably a couple of bush knife injuries every day in our ER. And when you have people with chops and extremity wounds, it's easy to get distracted by that wound, but you don't want to do that. You want to start with making sure that everything is okay in their chest and abdomen, making sure that the heart, the lungs, that there isn't any internal bleeding in the belly. We washed out the bone. We're going to get that closed so that she doesn't get an infection there. Hopefully she'll get antibiotics. And then tomorrow we'll let our surgeons take a look at her. But she may be one that we just keep in a cast for a while and let that slowly heal over time. All right, so we're just wrapping up our day here. Still on call till about 8 o'clock, but it's been a pretty typical day here at the Kudjip Nazarene Hospital in Papua New Guinea. We've cared for people with AIDS and tuberculosis. We've had traumas and chops with machetes. Had a cardiac arrest patient earlier this evening that we didn't get on footage, but been a busy day. Been able to pray with patients, been able to share with patients hard news that they have cancer, and to be able to try and pray and encourage them. Sometimes the days are exhausting, but it is really rewarding to be able to show people God's love and Christ's care. There's a quote I heard once that it's our duty as physicians to cure sometimes, to relieve often, and to comfort always. And I think that sums up care as an emergency room physician on the mission field pretty well. So thanks for joining today, and God bless.